Health Matters on Channels Television. Thank you so much for staying with us. I am Mary Alale Yusuf. Now, arthritis is a common condition characterized by joint pain or joint disease. There are at least 100 different types of arthritis, but the most common are osteoarthritis, rheumatoid arthritis, and gout. It can affect people of every age, gender, and race. The World Health Organization estimates that globally, 9.6% of men and 18% of women over 60 years old have symptomatic osteoarthritis. On the show with me today is a consultant rheumatologist at the Department of Internal Medicine, Lagos University Teaching Hospital, Idi-Araba, Dr. Uyi Ima Edonwoyi. Dr. Ima Edonwoyi is a contributor to the European League Against Rheumatism online training program and textbook, as well as a member of the American College of Rheumatology. You're welcome to the show.
Thank you very much.
Concerning the major types of arthritis, I mean over 100, but those three, what would be causing this joint pain or joint disease?
Okay, first of all, I think it's important to first of all state that arthritis is not a diagnosis like malaria is a diagnosis.
Okay.
Arthritis is pretty much like saying someone has a headache. If someone has a headache, it could be from malaria, it could be from a migraine. So it's just saying one has a painful joint that might be swollen and might be stiff. That's what arthritis is.
So you're trying to say that arthritis is a symptom?
It's more of a symptom. But there are 100 causes of that symptom. Yes.
Okay, but arthritis is treated, even though it's a symptom, right?
Yes, just the same way if someone comes with a fever, someone could be treated for the fever. A symptomatic treatment doesn't necessarily mean that the underlying problem has been identified.
Okay, but it causes pain and disease in joints.
Causes
now, what
pain.
is causing that pain and disease exactly?
So a point of correction, it's actually pain and could cause swelling.
Okay.
And stiffness and loss of function. Now, that's what we usually term as inflammation. Okay. Someone has pain in the joint, it might be swollen, might be stiff, and might find it difficult to use that joint for other things. So that essentially is what I believe you're trying to refer to. So and what happens is there are various causes, up to 100 causes of what we'll term arthritis. And like you said, one of the most common is osteoarthritis, which is due to the wear and tear that happens in the joints. There are others that are due to the body fight at war with itself.
Okay, that's an autoimmune
cause, of which rheumatoid arthritis is one of those. Lupus is another. Spondyloarthropathies are also there.
Lupus is put under arthritis?
Yes, it also may present as an arthritis. There are patients who walk in and they present what looks like an arthritis, and on further evaluation, we find out that what they actually do have is lupus. So yes, it's one of the causes as well. Then you also have other, it may be from infective causes, where an infection may cause the arthritis, or it may be what we call a crystal arthritis, and that's where gout comes under.
Okay.
Yeah.
Now, what exactly, can you tell us what's happening at those joints? The knee, the elbow, the hip. What's happening there?
Okay, so for me to say what's happening, first of all, I need to just give a brief, even though this is not school, but just give a brief description of what the normal joint is. When we say a joint, what we mean is that it's a point where two bones come together.
Okay.
But you see, the two bones don't just come together. If we just had two bones coming together, every time we attempted to move, we would all just fall into a heap. But you have things connecting those bones together.
We have a diagram of bones there.
Yes.
We have a normal one.
Yes.
Then there's one that is
then the two abnormal ones.
Yes. And then there's one that is rheumatoid.
Yes.
So can you explain that?
So you have the bone, against bone, but in between them you have that little cushion, which is called a cartilage. Then you also have this capsule. You have the tendon around it. Then you also have the capsule within which you have the fluid, which acts like a lubricator to the joints. Yes, to the joints. Okay. Because if you don't have the cartilage and the synovial fluid, which is the lubricant, every time we moved, we'll feel bone rub against bone.
Okay.
So the reason why we don't feel our bones rub against bone is because of these the cartilage, which I would call like a shock absorber.
Like a shock absorber, yes.
And that's actually part of its function, and the lubricant, which is the synovial fluid. So what happens is when there's any damage or dysfunction in any of these components I've mentioned, including the bone just below the surface, the articular bone, which is the surface of the bone themselves, the synovial membrane, the fluid, or the cartilage, whenever there's any dysfunction or abnormality in any of those parts, it usually will present with a pain, with swelling, with stiffness, or a loss of function of that joint.
Okay, it's not everybody that gets arthritis, but what are the risk factors for getting arthritis?
Okay, so first and foremost, the first thing I need to address is, does everybody get arthritis?
Okay.
In a sense, yes.
In a sense, yes.
Yes, any age group can be affected. Children as young as a few months old, children 5 years, 10 years, teenagers, youth, middle age, all the way. So all the forms of arthritis just depend on what specific type is at play in any given situation. There are some you tend to find with certain age groups than with others.
Like osteo is for older people, right?
So, yeah, so osteoarthritis, you tend to find it with certain age groups, like you rightly identify, mostly the older age group. But that doesn't mean it can't be found in younger persons. But when found in younger persons, it's most likely due to other risk factors other than age.
And what are these other risk factors? What are these risk factors?
So, for instance, being obese can put a lot of pressure on the joints. Someone who's been involved in a lot of sporting activities or lots of exercising over a long period of time, it could also cause that. Someone who's had some other joint abnormalities may also predispose to osteoarthritis as well.
Okay. When these areas become painful, does massaging help them? Because people like to say, okay, just rub it down with something, liniment or something. Does that help?
Well, again, it depends. Massaging doesn't really help, at least the underlying problem. You need to find out what the underlying problem is and then deal with it. But there are some other forms of what I would call non-pharmacological therapy. In other words,
without
therapies
medicine.
that are not, without medicine, that are also part of the management strategy in some of these. And these include things like heat therapy, and in some cases, cold therapy.
Depending on the type?
Yes, depending on the type. So for some people, it again depends on the individual. For some individuals, one works more than the other.
All right. So are all joint pains caused by, or are all joint pains arthritis?
Yeah, so that's a very good question. Not all joint pains are arthritis. Where we begin to have a concern as to there being a problem that needs to be attended to by a medical person, by a doctor, particularly a rheumatologist, is if someone, I would simplify it to these two scenarios. One, someone who's had joint abnormalities, which includes joint pain, swelling, for more than 6 weeks.
Okay.
If it persists for more than 6 weeks, then there is a problem that needs to be sorted out by a specialist. Or in the case of it not being up to 6 weeks, maybe like a day or two, like in some certain conditions, very excruciating pain that makes you non-functional, then you need to see a specialist.
By non-functional, you mean
not able to cannot carry out your usual activities, can't go to work, can't move around.
Because of the pain?
Because of the pain. Then you need to urgently see a specialist. In some cases, it might even be surgical. Usually when it's acute, sometimes it could be surgical.
Do you have a test for a definitive diagnosis?
So just like all things medical, you first of all need the first point of contact with the healthcare system, which is the doctor, is going to determine what type of tests should be done, what kind of diagnosis should be considered, because like I already said, there are over 100 causes of arthritis. So we don't just see a particular individual and say we're going to run investigations for 100. So there must be some heuristics by which we're trained to use to determine, oh, this is more likely due to the person's age, due to the person's gender, due to the person's background, due to this and that, the way it's presenting, these are the likely forms of diagnosis, to narrow down the field and then investigate on the basis of that.
Okay, so what if somebody's mother or father had this problem? Is it more likely the person will have it? Does it work that way?
Yeah, so that's a question of genetics. So the answer really is yes and no. Certain kinds of conditions, you tend to have some of these arthritic conditions run in families. In some other conditions may just be sporadic. In other words, it has no link with the family history. So it is not saying which it is per se. But in the event where it's clear that, it seems to run in families, I mean, then there's a strong possibility that there's some genetic risk factor there.